Hello, my name is Dr. Michael McCarthy. I'm an obstetrician gynecologist with Sinel Specialist Hospital. I specialize in treating women for fertility issues, issues of pregnancy. I take you through pregnancy from beginning to the end, do deliveries. I also specialize in uterine fibroids and fertility treatments and so on. I am also the CEO of Sinel Specialist Hospital here in Tema, and this is the place where we address fertility issues, address pregnancies, address children's issues, address surgeries, and so on and so forth. And it's a fantastic place. Come visit us. So today we are going to speak about fertility issues, very specifically infertility or the difficulty in achieving a pregnancy. This has to do with how to get pregnant, why some people are not getting pregnant, and what to do about that, and so on and so forth. And we'll give you the details as we go along. Infertility has to do with the inability of a couple to achieve a pregnancy. This may be the first time they are trying to achieve a pregnancy, or it may be that they've already achieved some pregnancies, but now subsequently things are not going as planned. So in simple terms, this is what fertility is about. So when a couple has not been able to achieve a pregnancy within 12 months of being together and actively trying without using a contraceptive method within that period of time, then we start looking for reasons why the couple is not getting pregnant. We expect that 90% of couples, yes, 90% of couples, and that's a big number, will get pregnant within 12 months. That number goes up to about 95, 97% in 2 years. So we're expecting that most people will be able to achieve a pregnancy. But for some, there are challenges, there are difficulties, there are delays, and that's what we are talking about today. Because we need to understand what the causes are, and then we can treat specifically according to the cause. So the causes could be from the male side or could be from the female side. And sometimes we have a contribution from both sides, and so it's a joint issue. For the female side, which is actually the more complicated side, I would say, the problems may be from the cervix, they may be from the uterus not being good enough, things not going very well in the uterus or in the endometrium, the inside lining of the uterus not being okay. Sometimes you have problems with the fallopian tubes where the sperm must go through and the embryo must go through, and these may not be working very well, or they may be completely blocked in some instances. We also have challenges sometimes with ovulation. This could be from hormonal issues, different types of hormonal problems, some hormones being a bit too high, others being a bit too low, and things not going very well. There's some disease conditions which can give rise to ovulation problems and so on. Then we also have the challenges from the male side. Mainly has to do with the sperm, where maybe the quality of the sperm, the number of sperms, how they are shaped, how they move, the percentage that are moving and so on, could all be challenges. So as you can see, the problems are multiple, and care must be taken to determine so what is the real issue, and then we can move further from that. So after we have found out what the problems are, we then target our treatment to the problem. So it's not just that we have a magic solution and anybody who comes in and we just give that solution. No, it really depends on what is going on. Sometimes it's just counseling, and that may actually solve the problem. And sometimes you need to directly address the issue. Could be medication to address the issue. If it has to do with the hormones, it has to do with some increased hormones or decreased hormones. It may have to do with some surgical procedures sometimes for the man or for the woman, depending on what the causes are. Sometimes there are some veins in the testes which are not working very well. Some surgery could be done on that. Sometimes there are things like uterine fibroids and so on, which may also require surgery, though not in every instance. And then we draw up a clear treatment plan for the next 6 to 12 months to enable the couple follow that plan and then achieve a pregnancy. Sometimes we need to go further than this and do things like artificial methods or assisted reproductive technologies. They could be as simple, let me say, as insemination or intrauterine insemination. They could be more complex, like IVF and related procedures. So it's a whole range, and it really depends on what is going on with the couple. There's a small percentage of couples who may not be able to achieve a pregnancy on their own. And so adoption is also a method of treating infertility in selected couples where that may be the solution for them.